Good morning, Olivia.
Good morning.
It is the 21st of September. It's exactly 2.5 months since we started the phase 1 orthotic therapy. And tell me briefly how you're doing.
I am doing a lot better than when I first came in. Marked improvement in all areas.
Yeah. Granted, we only was working on the lower arch. I think you're getting ready to start on the upper arch today, later.
Yes.
But we wanted to see if it would even help. Am I correct in remembering I was number 15th doctor?
I think it was around 15.
15, yeah, because you've been seeing lots of medical specialists and dentists and chiropractors and so on, and had many diagnoses as well.
Yes.
So that's one of the reasons we do. I always start with something reversible to see if it even help you before you get started. Speaking of help, your number one issue was
Brain fog.
okay. Tell me about that brain fog. How many days a week would you have brain fog then?
I was having brain fog about 5 to 6 days out of the week.
Okay, almost every day.
Almost every day.
Occasional relief day. Okay. And what will happen when you have brain fog happen?
Inability to concentrate on even really simple tasks. Word recall was really poor, just trying to find the right words.
And you're the communicator for your restaurant business.
Yes, so if I needed to type out an email that should be a simple email, it would take me a lot longer than it should have, just because I was having trouble comprehending, getting it down what I want to say and finding the right words.
Okay. And how's it now?
A lot better.
Okay.
So much better. I'm having more good days than I am having bad, and then when I am having bad days, it's not as intense.
And how often would you have a bad day? Once every couple of weeks, or?
Once every couple of weeks.
I think that's what you said. Yeah, it's less than there are weeks that you don't have any
Yes.
bad days. Well, good. And the second one had to do with the neck pain that you have, and the brain fog was going on for 10 years. But the neck pain, the next one was more like 6 years.
Yeah, that started about 6 years ago and just kind of gradually got worse and worse till I got to a point where I really couldn't do much because I was in so much pain.
Okay. And you said something about turning the neck.
Yeah, turning the neck over, my shoulders would give me like a dizzy, lightheaded sensation. And it was always really tight, like it was always very difficult to have any range of motion.
That thing I heard you'll see stars or something?
Yeah, see stars, feel lightheaded.
Okay. And how's it now?
Now the neck pain has gone down dramatically. And what neck pain that I do have, I'm able to deal with through stretching and
Okay. Can you turn your head now without problems?
yeah.
Okay. You want to show me? On both sides? And no stars.
No stars.
Okay. No Hollywood stars either.
No, nothing.
All right. And the third issue had to do with the shoulder pain between your shoulder blades and a shoulder. Tell me about that.
I would generally wake up with a really intense pain in between my shoulder blades. That would pretty much gradually throughout the day just kind of radiate through the upper half of my body. And since then it's almost resolved itself completely. So I'll wake up with pain every now and then. If I'm really being active, it might aggravate it, but it's to the point where it's slightly
Not a big
annoying.
deal.
Yeah, it's not disabling like it was.
Like it used to?
Yeah.
Okay. All right. And the next one had with the facial pain. Almost in your teenage years, you'll have tender spots and pain and so on.
Pain when eating. If I slept a certain way, I'd wake up in pain. Like if I slept on the side of my face, I would wake up in pain. Now the pain has reduced greatly. If I still eat some hard foods, I can have a little bit of pain, but just like with the shoulders, it's not as bad.
Okay. All right. And overall, you had lots of diagnoses. Overall symptom relief in 2.5 months.
Yes. It's been like incredible. Really, it has been incredible. I don't know. Sorry, I'm getting emotional.
That's okay. It's okay. It's okay. It's real. That's real.
Oh God. It's been crazy. I did not expect it. I mean, I was like kind of at the end of the, rope.
Okay. Part of it is you were given lots of diagnoses. Would you get a tissue for her, please?
Yeah,
You
I
had-
need to grab one for myself too.
Oh, yeah, lots of no problem. Yeah, lots of diagnoses. And tell me some of the diagnoses that you were given.
Ehlers Danlos Syndrome,
That's a connective tissue disease.
connective tissue, cervical instability,
Also had to do with the odontoid.
yeah, retroflexed odontoid,
Uh-huh.
postural orthostatic tachycardia syndrome, which is, posture-related changes in blood pressure and heart rate. Chiari Malformation, sorry, and vertigo.
Vertigo.
Yeah.
And then the
TMJ, of course.
jaw problem. But the bigger ones were the other things, not so much jaw, right?
I thought.
No, as far as
Yeah,
what
yeah.
you're suffering with. And I do believe you had a recommendation for a surgery. Tell me briefly what that was.
Yeah, it was, can we take a break?
Of course.
Is that okay?
I'm sorry to have made you cry, Olivia. But you had a break?
Huh?
You had a little break?
Yeah, I had a break. I'm good.
Well, mainly I was asking about the alternative you had and
Surgery.
what was recommended for you as a solution for your problems?
It was recommended that I do, I believe what is called a craniectomy,
Okay.
which is a pretty serious surgery, as well as a fusion.
Okay. The craniectomy would have been done at the foramen magnum, correct?
Yeah, it would have been removing part of the occipital bone.
Okay.
And then it would have been fusing either just the C1 and the C2 together, or the C1, C2 to the occipital.
So you'll be stiff on the first three segments?
Yes.
Okay. And the purpose was?
The purpose was to open up room for the, make room for the Chiari 1 malformation, and then
The brainstem.
Yeah, the brainstem, and then to stabilize the instability in the C1, C2.
Okay. And then what will happen to the rest of the neck?
I mean, I don't know. I was never really told what would
Because
happen to the rest
neck
of
is
the
supposed to be flexible.
Yeah.
If you lock it up in one part, something else has to give.
Yeah, put extra stress
Yeah.
on the rest
It
of
has, it's a matter of if you lock up one part, something else has to do more work.
Uh-huh.
And something else breaks.
Yeah, which is a concern because while I have instability up here, I also have disc desiccation and degenerative disc disease in the rest of my neck.
Lower.
So in the lower neck. So if I were to put more stress on that, I would think that it would just speed up that
That'd be
process.
next.
Yeah.
That'd be next. Was it even discussed?
No, it wasn't.
All right. And how about any of the risks and so on of that kind of a surgery? What all was talked about?
Well,
This is a neurosurgeon, I'm guessing?
yeah.
Okay.
There's always a risk of, it's surgery, so there's always a risk.
Brain
of-
surgery.
Yeah,
nothing.
brain surgery. So there's always a risk of, death or having some, damage that occurs that can't be fixed. I've even heard that, they can fuse it and then figure out they fused it wrong. They've got to take the screws out and you've got to get another fusion. So there's a lot of risks associated with it. There really is no guarantees that
That it will help your problems.
yeah, that it will help. It's,
Okay. How did that approach contrast with our approach?
it was extremely different.
In which way?
On one side, I'm taking a big risk and potentially sacrificing a lot for an unknown, result. Time, the money spent on it, the recovery time spent on it, the fact that they are, operating on such a delicate part of our body, that in and of itself, that carries a heavy weight to it, versus what we're doing here is very gentle, and there aren't these risks, these big risks associated with it.
Okay. And then nothing is done permanently.
Nothing is done permanently, yeah. Once you get a, I think a fusion can be redone, or maybe getting any part of your skull removed.
No surgery is really
Is
reversible.
really, yeah.
But what we did was add something to your jaw, lower teeth really, to align your jaw and neck better to see, just because I did all this testing means nothing until you actually feel better. That's the whole idea.
Yeah.
Then we on to do something like we're getting ready to start braces on the top. Now we're moving. changing things. Until now, we're not really changing anything permanently.
Yeah, so it's been, you know, there hasn't been really any risk.
Besides the money.
Yeah.
And the travel.
Yeah.
Travel, okay.
Yeah, so.
You mentioned briefly about your family's response. Totally understandable. What did your family say about this?
About this method,
approach.
they were a little taken aback because, and you know, probably a little bit of it was me because I told them like, okay, well, surgery I think is the obvious choice. It's what I have to do. Still in the back of my mind, I felt like if I can find something else. So when I did find you and I watched the videos on YouTube and I started kind of researching a little bit about it, and we actually met and spoke. And I saw great results after we got started. I was, you know, convinced that this is going to help. You know, I'm seeing results. It was hard for them to kind of grasp that, you know. They weren't here like every step of it. And
Yeah, I totally understand.
I can't explain it to them like you could explain it to me.
Also, too, it's totally understandable because it just seems so far-fetched. It seems way too simple.
Yeah, exactly.
It's not simple,
like
but just...
they were getting in the mindset of like, okay, our daughter is going to have brain surgery, you know, and then to go from, oh no, I think that's like maybe on the back burner. I think I'm going to do this, you know.
I'm guessing they're happy that you didn't have surgery.
Yes, they're elated that I didn't have surgery.
Good. Thank you so much.
Thank you.